Hello everyone, my name is Oluwatosin. Welcome to another presentation. In today's speech, I'll be talking about my hashtag. I'm a little bit excited about my hashtag today because I believe most nurses and healthcare workers can relate to this topic. Even students can relate to it. And the hashtag I picked today is ergonomics in nursing. So with no further ado, let's dive in. Ergonomic in nursing. It's maintaining the appropriate posture, body posture while doing the work, and minimizing and eliminating work-related injury in work environments. Also, it includes using proper body mechanics. So, what is ergonomics? It's the study of people in their working environments, and the goal is to eliminate discomfort and risk of injury, most especially back injury. It's also the science of equipment used to bring comfort to people in work environments. Why ergonomics? Because it prevents injuries from nurses, even from students. If we sit upright, if we if we use good body mechanics to lift patients, transfer patients, it prevents us from injuries. It also improves uninterrupted quality care. When we don't have back pain or any discomfort in our body, it propels us to do better and to deliver good quality care. It's also increased productivity, almost the same thing as uninterrupted quality care, but it increases our productivity in general. Injuries. Nurses are prone to injuries. They're always prone to injury, especially back injuries, lower back injuries. We always have musculoskeletal injuries resulting from heavy lifting, bending, patient repositioning, twisting, lifting object, transferring patients, and bad sitting posture while we're documenting. All this happens while we are at work, and good body mechanics and positioning helps us. So let's look at the physiological injuries common to nurses. It's neck pain. You feel the neck pain, shoulder pain, back injury, which is the most common one, is the most common one among nurses. Almost everybody, almost all nurses, like 52%, when I checked, have back pain, lower back pain. Then wrist injuries, the wrist when you're holding things, you're lifting, and you are basically touching um, touching stuff, holding, carrying. So your wrist could become weak or while you're chatting as well. So how do we prevent all these injuries we have? Preventing all these injuries we have, we could use good body mechanics while transferring patients. We could also use mechanical lifts when we want to transfer a patient that is heavy. We could use a proper chair like that has a good back support. We could prop the back of the chair with a pillow or some kind of cushioning to help her sit upright and not slouch. So we could keep our fingers in a relaxed state while we are charting, while we are typing, while we are typing or documenting. Then we could keep our shoulders relaxed as much as we can, and we should hold our hands, like put our hands very close to us when we're typing, not far away from us, but close to the body. We should bend our knees and keep our back straight, not bend your waist. Don't bend, do not bend at your waist, bend at your knees when you're bending down and lift the object. So they normally tell us to give ourselves a wide range of support, like open up your legs a little bit so you can have balance when you're trying to lift an object from the ground. So the next slides will be just be showing us a good part how to move the how to prevent injuries. So we can use proper body mechanics. You can see in the picture how to use body, how to use good proper, how to use proper body mechanics, excuse me. Make sure you keep your back straight, bend at your knees, not your waist, people. Use a waist belt, use a gait belt for safety purposes. That's how to hold it. And make sure you tell the patient to put their hands on your shoulder or on your waistline because your waistline is the center of gravity for you. So you make sure you tell them to put their hands on your waistline when you're lifting them. This will help you. When you're picking up objects, bend at your knees, keep your back straight, give yourself a wide range of support so for balance and lift the object off the floor. Also, get a back support chair, people. I cannot emphasize more on this. This actually works and helps because sometimes even if you work in the office, you spend most time sitting. So you need to get a good chair, a chair with a back support. You need to get that. You could Google it up and see. I Googled that up when I was typing, when I looked for ergonomics, and I saw that. And okay, I saw use mechanical lift for transferring patients. Every patient, do not do it by yourself. Please and please do not lift patient by yourself, especially every patient or any type of patient you can identify you cannot do by yourself. Get help, and if you don't know how to use the mechanical lift, get help as well. Please do not do it by yourself. Do not lift patient by yourself. Sitting upright while charting. You need to sit upright. Like it's required you can see how sitting actually affects the back. The good posture is the one Mac checked screen. So that's the way you should be sitting while you're charting or even sitting for any form of reason. Try not to slouch, try not to lean too forward, try to sit down and let your high level be on the same level with the computer. I googled, I checked on Instagram what like the predictive measures, and I found out the chairs and how you should sit down and some therapy you could use. Then the screen you could use two screens, and I was like, oh, this is cool. I think that's why I included this. I also googled hashtag ergonomics and found out that it was mostly about the sitting position, and this could be used for nurses, students, even workers in the office, and everybody, because this is the proper way to sit, and it helps our back, the back maintain. I found this funny. It's a little bit ergonomical, huh? So it's how to adapt jobs to the people who perform them. So this is something funny, and how you can see how is I'm a fan of Simpson, and you can see how he balanced his head upright, just the same level with the monitor. I think it's fine. Funny. Okay, so remember, Sat. Anytime you want to see it or you feel in pain, how to prevent injuries, stop. Just stop the activities that's making you feel the pain and get help immediately. Avoid prolonging of bending. Avoid prolonged bend of neck. Like do not bend your neck for too long, especially when you're documenting or you're charting. Or you could be looking at your phone. You could be bending it. So avoid prolonged and adjust your sit while sitting. Adjust properly. Adjust your sit while sitting. If it's not comfortable, prop it with a pillow. Sit and lift it. Increase the height, decrease the height, so you could be on the same level. And make sure you're comfortable. Adjust the sit. Stretch before. You could do stretches like this. Flex your muscles. Flex your muscles and go back to working. But before and after, it's very important to adjust. You stop first, you avoid, you adjust, and you stretch. So, ergonomics safety that I think I've made that clear and clear enough. And safety while you're charting the nursing station, safety while you're taking care of your patients, safety while you're performing other duties of your job like charting, like sitting, working, and every other thing. So it's all about safety. I hope you've learned a lot, and I hope you remember the next time when you're slouching, you'll be able to sit up and correct yourself. All right, thank you for your time and have a wonderful day.